Thank you so much, ma'am, for your nice introduction. Just a minute, I'll share the slide. Unnathi Healing Foundation is an NGO established in 2001 by Dr. Saraswati Hegde. Our vision is to influence and transform lives of people it touches through the ancient yogic healing practices, Panchakosha Vidya, with the inspiration from Grandmaster Chokoksi's teachings. It's an instrument to bring joy, happy, healthy, peace, and abundance into people's life and facilitate the one's individual purpose of life. The highlight is to produce quality certified yogic healers, trainers, and researchers in yogic healing biofield therapy. It is our founder president, who is biofield therapist, compiler of an ancient Indian wisdom of Panchakosha Vidya into Unnathi's yogic healing. She's a researcher, trainer, presented many research papers to her credit. She had PhD in child stress management. She's a skilled author and orator. This is our dream project called Build India Movement, which is a community-based mental well-being enhancement program to adolescents through peer mentoring to address the needs of adolescents like prevention of suicides, drug addiction, and so on. We have reached more than 5,000 health science students through this, covering 30 colleges and 15,000 adolescents from 70 schools with the help of Department of Education, Government of Karnataka in association with RGHS and NIMHANS. Now, introduction to our yogic healing, which is a biofield therapy. As everybody is aware, biofield therapies are non-invasive therapies in which a practitioner explicitly works with the client's biofield to stimulate and fasten healing response in a patient. It is also recognized under NHS. Yogic healing is a Panchakosha-based biofield therapy. Its origin is from Taittiriya Upanishad. We have multi-dimensional existence of human being that is called Panchakoshas. As you see in the picture, we have 5 different koshas, which has specific functions and existence. So any injuries to or any problem in this will impact simultaneously other systems. So treating all the koshas, all dimensions is important for a complete cure. The person's energy, what we call prana in Sanskrit, is encapsulated by pranamaya kosha, which play a crucial role in recovery of all these koshas. So this is a brief picture how we work in each koshas. What is the uniqueness of this kosha? How it is different from other biofield therapy? Diagnosis and treatment is based on identification of specific problems in each kosha and application of specific yogic healing techniques in each case. Yogic healing is no-touch drugless therapy. It includes the modulation of energy, prana in all the levels of Panchakoshas. So this gives an idea. We have different componential therapy, which addresses each body. Physical body, we work through yoga, exercise, diet, hygiene practices, and energy body through specific yogic breathing techniques and also yogic healing techniques. And Manomaya Kosha to deal emotions and thoughts through yogic meditations and techniques. Of course, Vijnanamaya Kosha and Anandamaya Kosha, which is least addressed through other biofield therapies through yogic-based cause and effect techniques. So with this brief introduction, I just shared my experience because I'm an allopathic doctor. Most of us will not suggest CAM therapies. So how I was influenced by yogic healing therapy. First healing, I was a first patient for myself. I took healing for dysmenorrhea. So till now, almost in 10 years of experience, I never get back this dysmenorrhea. And one of my sister conceived in an unexplained infertility through biofield therapy. My father came out of severe COVID depression, which the doctor told requires ECT. And my aunt came out of her COVID infection, moderate degree. Hospitalization was avoided and prevent lung complications and others. So with this background, I would like to call my another co-researcher, Dr. Sharath Kote, who is a medical gastroenterologist. He is also a biofield therapist and researcher to give an idea of our experience of yogic healing in COVID era. Thank you. Please, Dr. Sharath.
A warm welcome. Thank you, Dr. Bharti, for kind introduction. Just let me share my screen. Yes, am I visible? Audible?
Yes, Dr. Sharad.
Yes. Thank you, one and all. Thank you for inviting us for the practitioners-based research special interest group, because see, everywhere the research means it's sitting in the lab and doing the things and in a controlled situations. But a practitioner will be sitting in an OPD, which is an uncontrolled manner where we know the things how it works. We are trying to put the how the yogic healing will going to have an impact in our clinical day-to-day practice. Myself, a consultant gastroenterologist and hepatologist based at Bangalore, working at Site Care Hospital, and I've been practicing this yoga healing for past 20 years. I found it has been a tool for me for my success from my education time till the practitioner work. I finished my MBBS from JJMMC, then MD from KMC Manipal, and my DNB Super Specialty from GEM Hospital, Coimbatore. Coming to the work, what we have done from the Unnathi, we have multiple works keeping the COVID era. So we thought we'll present this one. It's a community-based participatory project under the name of Care Campaign during the second wave of COVID, where there is a lot of scarcity of bed, oxygen, and almost the disaster in terms of the mental health is concerned in a patients in the form of anxiety, COVID related anxiety, bed related anxiety, economic anxiety, loss of jobs, whether I'll be able to survive if I get a COVID, whether my children will going to survive or not. So keeping these so many things in the situation where we started our work in a multiple dimensions. One, we started for the people who are in need, like who are in home isolation, or the people who are in home not getting the bed on oxygen treatment. And also some of the people, even though there is a milder disease but lot of anxiety, they're having depression. So many, our patient also included the patients who are in ICU. So in that case, we started our services overall approach to our Unnati in the form of distant healing method. If I look into the left corner of this one, the COVID healing therapy as an individual, we almost more than 60 days continuously, all more than 30 healers every day morning 6 to 7 we sat, we did healing in the form of distant healing therapy. We also provided an opportunity for the people who are in home isolation, as well as who are suffering through the online platform. The meditation was there. Then who are in home isolation, we continuously provided the doctor's consultation along with the sequential monitoring of the inflammatory markers, as well as the saturation oxygen requirement. The outreach again we extended to the families who are having an anxiety, who are not yet got the COVID, but they are having the fear. So the community outreach programs also we started, where the 100 families have participated with the adherence rate of 80 to 90% for over 2 months. We have done this, and each session lasted for 45 minutes to 1 hour. It included pranayama, Bhagavad Gita sessions, yoga, Patanjali Yoga Sutras, and many more. It's also an informative session as well as the treatment sessions. It includes short meditations, and at the end there is a question and answers. And to overall impact, we found that it is very useful, that almost more than 70 to 80% of the people felt that it is better, and it has helped to overcome their anxiety and the stress. And also it has helped them to during the crisis period, if some of the family members are there, so they felt somebody is there to help us in that situation, where they know that none of the drugs were proven efficacious at that time. And also the another era is where the children doesn't have a proven drugs, doesn't have a proven treatment. We don't know what will happen to the child. So that is the where the young parents who are having the kith and kin between less than 10 years, we found that they are also in a higher group, so higher in number. So we help them to document them. One of the specific study which we have done, which subsequently Dr. Nisar will going to share. So the overall brief observation during the COVID care campaign was 100 families were participated in that online platforms. Total adherence is around 85 to 90% towards 2 months, and it was guided continuously. All the sessions were being mentored and guided by our founder president. The participants overall findings, what the feedback which they shared was self confidence levels were increased. There is a reduced COVID fear, as well as the anxiety, the fear of death, and also the social fear were reduced and able to express their concern and receive the support from the same, because it was also at that time it was a social stigma. If I get some family, I'll get isolated from the society. That was also the one of the things which they faced, so that they were able to overcome and get the help. And one of the devastating thing which a mankind never been exposed is a social isolation in the form of hospitals, where they have been around with the people who are having the mask and those things, and there's no family members in and around them. That's again in a familial isolation. That stress we are able to reduce during the online platforms, and they are felt that there is one extra support we got which is beyond our medical science, and the overall well-being they are able to maintain. The spiritual well-being improved, the mental well-being, every in all other dimensions which the WHO says, the other dimensions which we need to address, we are able to give it to the community through these programs. So one such of the thing is, when we did this, we thought, okay, let us document this in a scientific manner, which an Ayurvedic people or allopathic people or any scientific community which we expect. So we thought we'll do a randomized control trial for the patients who are having a COVID infections of mild to moderate in intensity in a hospital setup. We choose the people, we got an ethical committee clearance, because this was the thing, like this has changed. Why? Because COVID, we can call it as a boon or a curse. So in that way, the mankind has evolved over so many dimensions, from a just a physical dimension, physical treatment, physical treatment which we have seen during the COVID time. We, as a doctor, when I am working in the COVID wards, we used to feel that how the person disease will modify his whole behavioral pattern, whole his mental patterns, whole the way he thinks. So this COVID era or a pandemic has shown the limitation of our healthcare system, because we in a healthcare system, we always provide just a medicines. We never try to go beyond that, unless we say psychiatrists are there, they do counseling. But what is the other dimensions which we are supposed to? So the people gone into other supportive therapies, where we know that there is no definitive management, so they took the help of Ayush, other Ayurvedic medicines, other complementary. So in that way, Biofield therapy, which is a non-invasive therapy, which is a practitioner explicitly working on the client's biofield, where we interact with the energy fields that of concern with that living beings. So where our chakras, the nadis, the energy flow, everything will be there. So where the Biofield therapist will work on them and help to overcome the problems and faster recovery. So this has been practiced across the world with various different modalities. Our Yogic Healing works at the level of Panchakosha, means where, as previously Dr. Bhate explained, the Panchakoshas means there are problems as different kosha even in COVID time. So unless we address that, we'll not be able to reach. So this Panchakosha is extensively discussed in Taittiriya Upanishad, and this is these energy-based therapies have been clubbed under biofield therapies in a Western world and it has been a well-recognized nomenclature in NHS, and to show how this can modify, how the treatment can modify the person's recovery, from a physical recovery to the mental, emotional, how it has been helpful. So we documented through this study, where necessary all the ethical committee clearance were being obtained, and we choose the people who are in ward and ICU of moderate, mild to moderate in severity. And the study was stopped in between. We thought we'll make at least a minimum of 25 in between. As the wave subsided, we the total number of participants I would able to study were around 5. And the therapy we in this we included is the distant or the remote distant yogic healing therapy, and a short guided pink light meditation, which is of duration of 5 minutes. Because I choose only the meditation for 5 minutes, because many of the people might not be able to sit for longer time, and this meditation people can just even in a lying position can do. Even if the patient having a breathing this one problem, they can just simply hear and just follow the thoughts. That's also is a possible. That's why we choose only these two as an intervention. The assessment what we used is a what before starting my study, what is the baseline oxygen saturation, what is the oxygen requirement, what happened to the oxygen saturation and requirement before and after healing, and daily monitoring, and also to assess the other mental well-being. So I choose to use a psychological assessment in the form of GAT-7 questionnaire, PHQ questionnaire, and COVID anxiety scale. And all these questionnaires been executed by myself. I went inside the ICUs and I taken all these things recorded. So this is one of the master table which I am seeing is the all the things are 5 patients what I choose. In that 4 were males and one is a female. They have been except one patient, 2 patients, they all them having a comorbidities in the form of either thyroid or diabetes. 2 patients had a hypothyroidism and one patient has diabetes and hypertension. And the severity wise all them one patient was mild to moderate and one or 2 patients were severe and another 2 patients were moderate. So the if you look at their baseline saturation, everybody was below 94. 1%, female patient who is 66 was in 94% uh, at room air, except other that lady, the rest all been in a moderate to severe in intensity with a baseline saturation around 76%. One is at 92%, and rest all around 80 to 90%. CT severity index was almost nearly all are in moderate to severe in this one. If you look into the case one, the day one, which made me to astonish how the healing works. Just before starting the healing at 6 o'clock evening, I went to document those things. He was on 6 liter oxygen at 96% saturation. After the healing at 9 o'clock, when I called back and documented that this one is, he was able to maintain saturation of 98% at 1 liter within a span of 3 hours. We were able to demonstrate that we were able. Am I audible? In between, some noises are coming.
Yeah, audible, Dr. Sharad.
Oh. Yeah, so we are in the span of 3 hours, we are able to reduce the oxygen requirement by 2 liters with an improvement in the oxygen saturation by 2%. That's also, I felt it's an astonished. Then I started continuing. And what happened to the next day two? We are able to maintain the saturation 100% at room air. So within a span of 6 o'clock in the evening, morning 6 o'clock, 12 hours, we are able to drastically reduce. And he was discharged on day four. If you come, then the 79, which is always an elderly in a second wave, it is always dreadly, because many patients who are after 60 with even though whether there is a comorbidity or not, they were almost succumbed to that, more than 90% mortality. With the age of 79, he was on 96% with 6 liters of oxygen. And with the healing after 3 hours, we are able to again we were able to reduce the oxygen requirement and increasing the saturation up to 98%. Even next day, within 12 hours, he came to 2 liters with the oxygen saturation of 98%. So drastic, we are able to reduce by 4 liters, which usually doesn't happen in a COVID scenario, which I observed during our COVID rounds. Usually it takes, when the person is on steroids, all those things, with such a severe a 96 liter in, and within 12 hours we never come back. Usually we give a span of 48 hours. And at the day of day 4, he is able to maintain 98% saturation at room air, and day 3 also he is able to maintain. So on day 4, most of our patients are got discharged. That's the beauty of the study. What I understood is day 4, day 5, we are able to discharge even though the severe patients. And the next patient, if you look into the fourth patient, she's a 66-year-old male patient with moderate in intensity. 90% was at room air, and he was requiring almost 6 liter to increase the saturation from 90 to 96%. And we are able to, within the next 12 hours, sorry, 12 hours, from 6 liter he is able to come to 1 liter, maintaining the same saturation. So almost nearly a drastic reduction in 5 liters. And next day, within 36 hours, he is out of oxygen with 100% maintaining saturation, and he was discharged again on day 4. Similarly, in the other patient, in the last patient, he was requiring 8 liters to maintain a saturation of 95%. In a matter of 12 hours, we are able to bring down to 2 liters, and along with the maintenance of it. So it, all these things, what it gives us, yes, definitely there is associated treatment is there along with these medications were there, everything was there. But when compared to the people who are just on the medication, the impact was very much worse than those who are overcome their breathing difficulty. Let's go to the psychological issues. If you look into the GAT7, day 1, day 3, day 5, I documented every alternate day. The score were almost drastically, we are able from 20 to 0. But okay, at the day 5, obviously patient would have been fine. The anxiety levels comes down. But what happens on the day 3? Means very after day one intervention, day two, day three, what is the thing? It comes almost more than 75% reduction in the anxiety levels. And similarly, in all the cases, we are able to demonstrate that these case 2 and case 3, they didn't have much of the anxiety at the baseline. So but even though there is a mild reduction, but baseline itself is slightly low. But case 1, case 4 and case 5, if we see that the drastic reduction is almost more than 60 to 80% at the day 1 to day 3. Similarly, the depression as assessed with PHQ2, that also most of our patients did not show much of the depression, except the case 4 and 5. If you look, their scores were very high. Other than score 4 and 3 were there, they are able to day 3, they are able to reduce their depression component. But again, it's a subjective this one, even though and there is an improvement, because day 3 there most of the patients were improved. But the psychological component, if you look into the compare these things, even though we attribute for the recovery from the breathlessness, but if you compare to the other people, they have a post traumatic stress disorder, they had a lot of, even though there is an injury, they have that social isolation, familial isolation has made them to have the persistent depression symptoms. And the sleep quality was greatly enhanced. See, if you before the healing sleep, if you rate from 1 to 10, their quality of sleep is almost nearly 2 to 4 is the average thing is around 4 if you look. And it has improved on day 1 after the healing of 3 hours. The day night, next day morning, when I went and approach what happened to their quality of sleep, it has greatly enhanced, which the last 2 days they were unable to sleep at all. Their quality was terrible, they were in nightmares. But the next day, on the day of healing night, they are able to have a peaceful sleep with a almost rating up to 7 to 8. This is almost an 80% of their quality of sleep which has been improved. In that, compared to again the COVID anxiety scale, where the score of more than 9 was considered to be present, and it shown that all the patients were in COVID anxiety, and the day 3 they are able to come back to normalcy. See, these all the things were able to demonstrate that there is a significant reduction in the anxiety, depression, the improvement in the sleep quality, as well as the COVID anxiety scale we are able to demonstrate. And this was, when compared to other patients which are seen in our COVID wards, is drastical improvement which has been able to demonstrate with the help of the yogic healing. The important findings in comparison to the similar patient, what I saw was drastic reduction in the oxygen requirement, improvement in the oxygen saturation, improvement in the quality of sleep, and decrease in the anxiety scores. Thank you.
Thank you, Dr. Sharad. Please, the team, any questions for Dr. Sharad?
Dr. Bradu, Dr. Skantesh, any suggestion, recommendation in terms of scientific analysis or anything?
Hello, Dr. Sharad. This was a very nice presentation, and I came to know many things about it regarding your healing and everything. I just have one question. While you were just observing and giving the therapy, were you also giving some other kind of medicine or treatment besides oxygen?
Ma'am, we continued the treatment, treatment like steroids, and who are on severe, the antivirals were continued, ma'am.
Okay, okay.
So yogic healing was an adjuvant.
Yeah,
Add-on.
that's why I put it everywhere. It acts as a complementary.
But then in your comparison group also, you had the similar treatment given except the yogic healing. So in this regard, we do have a control group, which is randomized.
Because regularly when you... Yes, ma'am. One second, ma'am. 1 second. It is not audible. 1 second.
I think your screen share is quite widely.
One second, ma'am.
Okay. Okay, this should work. Any other questions? Any other recommendation for Dr. Sharad's work?
Okay, this should work. Any other questions? Any other recommendations for Dr. Sharad?
Hi, Dr. Naga. Is it audible?
Yes, yes, Dr. Skandesh.
Yeah, it is great to see Dr. Sarath your presentation, and that adds more value to the practice-based evidence initiatives. And this also gives much more emphasis regarding holistic perspective and the methodology that need to develop in order to validate its effectiveness. So my thinking would be whether you have any thought of relevance that to document the patient's perception regarding therapy, because the therapy is addressing much more than just providing a medical aid or something. It's more than so it deeply engage with the patient's mind and consciousness. So do you feel relevant that the patient experience towards the therapy need to be documented in order to see their perception towards treatment? Thank you.
Okay,
Yes, sir,
I
what you
think
told is-
I'll just quickly step on it. Sorry, Dr. Sharad, you please add on. But regarding your question, Dr. Skandesh, that was the idea initially, that it was taken as a mixed design, because the whole purpose was also to gather the patient's perspective, their acceptance and their satisfaction to be very, very vaguely, but also what really made a difference. So qualitative methods were used, but then in this regard, for presenting or compiling, that could be a complete mixed method study we are thinking to compile with Dr. Sharad. Sorry, you go on, Dr. Sharad, if anything I missed. You are muted, I guess. Other than qualitative methods, or
No, I'm adding.
is there any other suggestions you may have, Dr. Skandesh, to gather the patient perspective?
Ma'am, we can't hear you.
I think I'm not sure which side and what's happening. Dr. Skandesh,
Yeah, now I'm able to hear you. Yeah.
okay. So is there, other than the mixed method or qualitative measure, is there any way you also suggest that patient perspective and experience could be gathered or could be thought of?
Yeah, I do think that maybe we can also think about more personalization that can be done in order to validate it.
Could you elaborate, please? How?
Could you elaborate, please? Could you elaborate, please? Could you elaborate?
We are not able to hear anything, ma'am. Ma'am.
Again, it's a question for Dr. Dr. Skandesh. Would you mind, Dr. Skandesh, bit more elaboration how we do that, especially in terms of the practice? Yes.
Yeah. Hello.
Yes. Especially.
I think we can think about many more innovative designs regarding N+1 trial and all those things, which we can have much more personalization in the way how we can approach and design the methodology for these kind of interventions, I feel.
Yes.
So there will be
trial.
much more personalization and customization that we can give for the design, I think.
Yes, this trial actually could not proceed because of the recruitment issues, and the COVID wave was passing on. So we could not find any more COVID patients during the trial. So trial was suspended, but we had, so I think this respective work would be analyzed now as a retrospective or maybe as a case series, so yes, but if we take the trial as a design ahead, there are personalization which we can use for the future studies. But for this specifics, what we have in hand, they have used mixed method. They have used the, I am aware that they have used the interviews. So that could be documented in some way, but not as a trial design, because it's not enough for going ahead as a pragmatic or any other trial design. Any other suggestion, recommendation, please feel free. I'm aware of the time, so I might like to little bit rush for our next presenter and next work, which Dr. Nisarg is presenting, and this is already shared by Dr. Sharad. It was a parenting support, specific parenting support, which was designed by Unnathi because of people, they wanted this specialized support. So what really happened, and that's still a concerning area which a lot of parents and families is looking for. So I would like to hear and come back at the end, maybe more on discussion of the trial or designing or logistics of the research, if that's okay. Dr. Nisarg.
Ma'am, if you would allow me to
Yes, you
enable.
are. You can present, yes.
Can I start, ma'am? Is it visible?
Yeah, it's visible. Please, you can go ahead.
Okay, good evening, everybody. So it's an honor to be part of the Practitioner Research Special Interest Group. Today, so we'll be talking about yoga-based biofield therapy. So myself, I'm Dr. Nisarg Arvindan from Unnathi Healing Foundation. So today I'll be talking about the impact of yogic healing meditation techniques on COVID-19 related anxiety and perceived stress among the young parents. So just a small brief about myself. I've completed my MBBS from ESI Medical College from Bangalore. Currently doing my MD in Community and Family Medicine at All India Institute of Medical Sciences, Rishikesh. So I've done a few management programs. So one of them mainly being the program at IIM Ahmedabad, and also having done an internship at Niti Aayog, which is the public policy think tank in Government of India. Right now, I'm going to complete my thesis, for which I've received an ICMR grant, and currently working with Unnathi as a team lead for the Build India movement. So I'll be a bit brief about what exactly we went up. The pandemic brought about many challenges with the limited availability of medication and vaccines, and which were also especially focused on the adult population. So because of the lack of vaccines for the pediatric age group, because children are so used to getting vaccines for many vaccine preventable diseases, COVID was one such unfortunate situation where there were no vaccines for the pediatric age. So there was more corona-related anxiety, worry, fear of COVID death, social isolation among young parents, making them restless and overprotective of their own children. So they also worried about engaging children all the time due to the lockdown because of increased screen time. So the children, again, it was affecting their behavior, and the parents were further stressed. So this led to poor well-being in the household, trapping the family in a vicious cycle. And to help the parents out and the children alongside them, so this project was done to extend the support to the families to document young parents' anxiety and the efficacy of the intervention. Just a second. Yeah. Yes, moving forward. So what we would like to again point out is this was a community-based participatory research project as a smaller part of the COVID care campaign project, where we focused on parents who approached Unnathi for their specific needs, which were included in the study. So the sample size consisted of 14 couples, of which there were 28 participants in total in the study. And this study was done for a duration of 10 days, where each couple received a guided yogic healing meditation via video conferencing. So the total duration of the meditation was of 20 minutes, which was preceded by a 5-minute physical exercise and concluded with a 5-minute physical exercise comprising a total duration of 20 minutes. This was done on a daily basis in the evening for the 10 days duration, as I had mentioned. So the group intervention was mediated by specifically assigned yogic healers who were there in the video conferencing. And to assess the outcome of COVID-related anxiety, we used 2 questionnaires, basically being the COVID-19 anxiety scale as well as the perceived stress scale. So what we found, we would be dividing on the baseline as per mental well-being, emotional well-being, as well as social well-being. Coming to the mental well-being aspect, that would be the objective score that we have obtained by the 2 scales, the outcome measures, where we saw there was a improvement in the COVID-19 anxiety scale as well as the perceived stress scale. The emotional well-being also showed an improvement in the subjective emotions, with them experiencing a lot of positive human emotions following the interventions. And when we asked for feedback after the sessions, after each session and even after the day 10 of the session, we found that they personally expressed that their COVID fear reduced to a great extent, with a sense of feeling connected to each other. And the third aspect which we would be covering would be the social well-being. The social well-being was assessed in the term that the couples experienced a greater sense of security for their own families, as they felt that they belonged to a larger community of people who had similar fears, but they did not express it. So, but they also felt that through this method of daily meditation organized by Unnathi, the common fears were being addressed. And as Dr. Sharath mentioned, that the pandemic had caused more loneliness. So he talked about the hospital-based setup where they were separated, the patients were separated from their families. Even then, the pandemic, within those who were healthy, within their own homes, they had a month-long lockdown, which was enforced, as we all know. So this daily support actually helped them to cope with not meeting anybody they knew and always having that fear of meeting anybody that they knew they could be a carrier of the virus. So that thought itself created a sense of loneliness, and they felt that the social well-being in that aspect was covered. So the brief we would like to draw from whatever the study was done was that yogic healing meditation has a very wide applicability in enhancing the mental, emotional, as well as the social well-being of those who practiced it. So our way forward would be that we will be looking to do further targeted projects for the specific requirements so that we can explore the larger applications of the yogic meditations that we have within us. Should I continue to share the screen, ma'am? That would be the short presentation that I have. If I should stop sharing and answer the questions, I would be very happy to do that.
Any questions, any recommendations by the research group?
Hi, Dr. Nassim. Am I audible?
Yes,
Yes.
Dr. Nassim.
Please go ahead.
Thank you for such a lovely presentation. I just had one question. You said like you did 5-minute exercise, like physical exercise before and after the meditation. So what kind of exercise did you use? Was it yoga or any other kind?
Okay, so as part of our meditations, we have a simple set of basic stretching from upper body to middle and then just the limbs. So it is yoga based specifically. It won't be any very high intensity physical activity. It is simple yogic postures, so to speak, but it is not exactly under the ambit, but yes. So it is based off Hatha yoga postures, so to speak, but it is a proper set. We have a certain order of exercises that they need to perform before and after for 5 minutes.
And that was common for everybody?
Yes.
Okay, thank you.
Should I stop, ma'am?
Dr. Skantesh, Dr. Mridu, any recommendation for compiling this work other than practice-based data coming through. Unnathi?
Hi, can I ask you something? So,
Yes,
as
yes.
part of CBPR, whether there were any specific methodology to evaluate the community need when we are incorporating this as an, when we have felt need and perceived need, whether
Right.
there were any specific methodology that has been, made in order to evaluate that, to incorporate this particular healing.
Sure, sir. I think Dr. Sharath would be able to explain a bit more about the community-based participatory research. So I had focused more on the pilot project. Dr. Sharath, if you had anything to add, that would be great. Hello. Hello. Am I audible?
Yes, Dr. Nisar.
Yes, ma'am. Dr. Sharath or Dr. Bharti would be able to enlighten us in that area of CBPR, because we were focused on this pilot at the moment. But Dr. Bharti, ma'am, please, if you would like to add.
Yes, sure. So it was started as a COVID campaign care project, as Dr. Sharath has told. So in that, some people, some specific parents which were under, whose children were less than 10 years, they wanted to actually more support. So they actually approached the Unnathi by themselves. Then the Dr. Nisar was, he was a principal investigator, and he took the project and he supported the young parents. So he was supporting the parents, as well as he was took that data and done it as an independent researcher for analyzing what has happened to those young parents. Anything else, Dr. Neha, ma'am?
Actually, I do have a question also. It's just I'm curious about it. The parents which you have enrolled, or those who have approached Unnathi for this project, I want to know what they like. They were suffering from COVID, or they were just preventive, or they faced the COVID by themselves or not? Were they
Yes,
COVID?
Yeah, thank you for the question, ma'am. So actually, the parents themselves did not suffer from COVID. It's just that they were part of the common group, but then they mentioned that they had this specific fear that they might transmit the COVID infection to their children. So by
Yes.
themselves, they were not positive when at the time of performing the specific intervention.
Okay.
Yeah,
Okay.
out of 14, ma'am, Mrudu ma'am, in the 14 cases, there was some family history, maybe 5 to 6 families, they had distant relatives dying of fear, death and all. So that was causing them more anxiety. So that's why they want, because they worried more about their younger children. As Dr. Nisar told, there was no vaccination. So that was the main.
Okay. Thank you very much.
Thank you, ma'am.
Regarding CBPR, does this answer your question, Dr. Skantesh, or would you like to be more specific? Would you like them to be more specific?
No. Thank you.
Yeah,
I think it. Yeah, it clears.
Yes. See, bearing in mind that this is all still a very raw work, which is coming from practice, which is still undergoing to the structuring in terms of compilation and analysis. So yes, each of your feedback on the research methodologies are very welcome, because we are still in a process of doing that. But when all this work which has been presented, initially there was no plan of doing research. It was a community initiative. But when the data and the work which they saw the improvement, I think this is where it all led to research, that it should be analyzed in a scientific way or be presented in a scientific way. So this is the other way around, that practice-based work, actually, we are looking at compiling and putting forward as an evidence. So I think with Dr. Nisar's works, I would really think that a lot of social networking and how the impact as a society when they created as a whole camping, it's just not the meditation which only have put the significant difference, but it is also the sense of community which they developed as part of the meditation, like regular group meetings, 10 days intervention, and somebody to talk through as a peer-led support. So I think this is also a contributing factor. In terms of developing an intervention, if we say this is whole intervention which was developed, I think this is where we would justify the outcome of the work. If you have any different ideas, please, we'll continue after the group meeting. But I would request again, Dr. Sharad, is it Dr. Sharad next, presenting the gastric work, or Dr.
Yes,
Bharti? Yes.
Supposed to be Dr. Sharad.
Yes, please.
Dr. Sharad, are you connected?
Ma'am, I believe it's better you present for now. I'll coordinate with Dr. Sharath once he's back on.
Dr. Bharti, you carry on, because your work is
Yes,
also related with children, which is very, very continuing with Dr. Nisarg's work.
Yes, ma'am, sure. Good evening once again. My topic is something different from the other two. It is not related to COVID. Here we are testing yogic healing as a self-supportive complementary therapy to the parents with children with the behavioral problems. I'm a gynae specialist basically. Behavioral problems are very common in children, more so in neurodevelopmental disorders such as autism and ASD. Prevalence is as high as 45% among the children. Prevalence of autism is 1 in 100 children and ADHD in 5%. As we're aware of the symptoms of ADHD being hyperactivity and impulsivity, and autism, it's more of a developmental delay, speech abnormalities, and we have repetitive, both sensory and motor problems with the emotional problems and difficulty in socialization, learning, and also language difficulties. Most of these require longer duration of treatment. Causes, as we know, mainly brain injury, exposure to environmental risk, extreme age of parents, alcohol and tobacco use by parents, preterm labor, and also low birth infants, and specific genetic developmental disorders in autism. How yogic healing can help in behavioral disorders? We are aware that there are different treatments available to address the physical, emotional, and mental components of the behavioral disorders. Most of these will manifest as energy disturbances in the Manomaya Kosha through chakras and meridians. The intelligent factors will manifest as an energy disturbance in Vijnanamaya Kosha with the improper synergy between Manomaya Kosha and Vijnanamaya Kosha. We have specific things how to diagnose this, yogic healing techniques. So yogic healing by manipulating these at Panchakosha level will help the child. It is useful as it is no touch drugless therapy. And beauty of this is that it can be learned by the parents, who are the main people who can support this child lifelong. So as per the case series, it's a total number are 7. All were male child. Age was ranging from 4 to 14 years. All cases had medical diagnosis. There was 3 cases of ADHD and 4 cases of autism. Most of them actually fall into both the ADHD and autism spectrum. 5 cases were diagnosed post-COVID and 2 cases were pre-COVID. So this is a chart showing the same thing. Here, along with the yogic healing, both standard line of medical and other behavioral therapies as suggested by the doctor was continued. Here, in one case, though the diagnosis was done just when the COVID was started, so that child didn't receive any kind of therapy. First, it came to our center. So this was a case 1 where it was diagnosed as autism. It was a forceps normal delivery. The main complaints were again of the autism, like inability to listen, no eye-to-eye contact, hyperactivity, aggressive, adamant behavior, and difficulty in writing, and there was no physical challenges. This child is still on treatment. It started just afresh 2 weeks ago, and there was improvement was seen in both parents' acceptance and also ability to support the children. In this case, the child hyperactivity and repeated movements and eye-to-eye contact, all these were improved from 10 to 5, and he was able to sit and follow the instructions from 10 to 5. We used a scale of 10, where we thought that 10 is the highest problem what the child can have, and 0 is the least. In the case 2, it was an ADHD. Here again, the child was hyperactive and was not able to follow the teacher's instruction. And there was the typical what mother was telling was difficulty in writing. The child used to write in a reverse manner from left side to right side. That was the greatest challenge for that mother. 1 month healing was taken. Here actually patient acceptance was a little bit improved, but patient's ability to support was not so good, because mother was not ready to accept that the patient, her child is having some problems, and also she was too much pampering, and she didn't change some of her fixed ideas about the child, and she wanted within this he has to improve. So there was a lot of expectation from the mother. So they didn't undergo any training, and they stopped the treatment also. But there was improvement. The child was hyperactivity was reduced from 10 to 5, eye contact was improved. He was able to sit, and the problem what they came for, that writing skill, it improved from 10 to almost to 5. In case 3, again, it was a diagnosis of autism, not autism, ADHD. Hyperactivity was seen, and not able to focus, and stop reading and writing when he was not able to understand. That was a major concern of the mother. Here, the parents' acceptance was very good, as the child had some birth injury. A parent's ability to support was good, and mother was trained in therapy herself, because this child took almost 4 months of healing. Then the mother underwent the yogic healing therapy training, and now she is supporting her child, and she is under constant follow-up guidance under Unnathi. There was improvement in the child, especially the expression become better, and his writing skills, actually it was improved, and aggression reduced. His behavior with his brother become very nice. Then again, case 4 was autism. Here the main complaint was aggressive behavior and difficulty in writing and reading. Actually, there was a doctor diagnosis of speech language disorder with low IQ of about 70%. Again, here the child underwent 2 months of healing. Only the mother accepted that there was a problem with the child. So she accepted, and she was also guided by herself. And then parents changed the school as per the guidance of the therapist and the doctor. Then, so these people actually observed very nicely about what are the improvements happened. Actually, the mother said his self-caring ability was improved. He was able to do his normal activity without troubling his mother. Then care towards others also improved, and speech became better. Then the next case, again, it's a case of ADHD. Here, again, the hyperactivity and inability to focus was a main concern. Here, mother has recognized the problem. She had accepted the child's problem. They stopped the therapy due to death of some relative. Parents could not undergo yogic healing therapy here. But there was an improvement in child. Eye-to-eye contact was improved, and hyperactivity reduced, and his aggressive behavior was reduced, and he was able to sit and write with specific instructions. In the next case, again, here it's a problem of autism again. Mother has recognized the problem and accepted. Mother learned the therapy, and herself she supported. Here, the child underwent almost 2 years of healing. Expression part become better, anger reduced, writing skills were improved. In the last case, again, it is also autism. Here it was a LSCS and there was no birth injury. Here the problem was not able to talk, no eye-to-eye contact. All these were present. Patient accept here. The beauty was that both the parents learned the therapy and now they are supporting under our guidance. There was an improvement here also significantly. So in most cases, we applied the therapy thrice a week by direct healing approach. Improvement started observed after second or third session of yogic healing. In all the cases, standard medical care was advised to continue. The therapy, as I explained in the beginning, it was addressed in all levels. And specific instructions were also given to the parents depending upon their individualized case. There was some among all of them, two parents didn't continue the therapy. There were some challenges seen in this parents. As a behavioral disorders are lifelong with the new challenges, parents' preparation, especially the mother, is very important. The acceptance of child problem was a challenge by some parents, working parents, especially where they cannot give the quality of time with the child, they can discontinued. And one more thing was the acceptance of the changes seen after biofield therapy was difficult for some logical and professional parents. Like as I shared initially, allopathy doctors will not so easily accept that. In some cases, the parental inadequate effort was also the reason to stop the treatment. So I just want to conclude with the this thing that yogic healing can be used as an add-on therapy in almost all the physical diseases, both communicable and non-communicable diseases, psychosomatic diseases, and psychological diseases, and even in cancers. It is primarily used as an alternative therapy in preventive healing and also mild to moderate psychological diseases like stress, depression, and PTSD, and diseases with mild to moderate severity like pain management, migraine, and functional disorders. So I thank everybody, especially Dr. Neha, Skantesh, Kritika ma'am, and also Mrudu ma'am, and Ayan and AA UK, and Unnathi Healing Foundation, especially our Saraswati Hegde ma'am, and Trustee Arvindan, and all our healers. Thank you.
Thank you. It's very, very relevant and very important topic, Dr. Bharti, which you have shared. And I have seen this work myself, and I am sure that parental participation itself is very important in this special need cases. Any questions, any recommendations by the research or any other practitioners, please feel free. I think it's a subject topic of a match with Dr. Mridu's expertise, because she also has recently worked with us, and of course in her wider expertise many. Dr. Mridu, any suggestion, recommendation you or similar findings you may have what Dr. Bharti has just shared?
Thank you, Dr. Neha. Yes, we come through such kind of patient, but in Ayurveda, we do some kind of like brain tonics and panchkarma therapy and other diet and behavioral therapies we induce for the patient. But this is a different kind of concept, and it's really very nice that it has shown improvement. There's another way, and it's a challenging problem nowadays. Behavioral disorders are very common in children. So there should be multiple type of treatments also. So a person can get whatever he or she needs. So, and a non-invasive therapy is definitely better than any kind of treatment if it is showing the good result.
Thank you. Especially in the needs of children, parents also prefer non-invasive, non-medical, non-interventional all sorts of, and it's a very tricky part when we go to the psychotherapies or therapeutic behavioral therapies, because some children are very young for those therapeutics. So in this scenario, I think yogic healing has a wider potential to bridge the gap where children are involved, where limitation of medical treatments are involved, and also the implication of these therapeutics because they are still children. So in this regard, I think, at least to start with, yogic healing could be the first recommendation to say, if then improvement starts, of course, there are other therapies which can be added on. That is something on my take on, and understanding.
Yes, definitely. Yes, and it is also a way of life. If a person is going through such yogic healing, he's going to a better way of life, living a good life.
Yes, thank you very much. I am aware of time and we already have taken extra time, but just the last, Dr. Sharad, because of technical difficulty, he wasn't here. Dr. Sharad, if you are here and if you can, I would like to see the gastric cases you have. I understand if it's a repetition of the therapeutics, we can skip because you have shared wonderfully different way of therapy. Yogic healing is integrated. So, however you decide, please, if you can have quick look of your gastric OPD.
Yes, ma'am. Thank you. I'll take not more than 3 to 4 minutes. No, I'll just try to cut off some of the repetitions also. Bhartika, just go to the third slide. Next slide, next slide. Next. Okay, in a COVID scenario, we know that many of the, whether it's a psychological symptoms, physical symptoms, even the pain perception, everything has been exaggerated, because here as per our science, we say that it's the gut-brain axis which plays much role. As Ayurvedic practitioners, many of them, they know that food is the major a treatment modality as well as the preventive modality, we say, because the gut is the entry point as well as the exit point. Here during the COVID season, what I observed during my OPD is there are many GI mimics, because most of the patients come with chest tightness, there is some reflux disease, or if the patient is having a prior disease like IBD or a GERD, which they found that almost more than 60 to 80% the prevalence and the incidence has been increased because of the COVID fear and stress. Because and the quality of the person, life of a quality of life is very much affected when compared to any other time, because it's always depend upon our internal milieu. The internal status of a person always includes not just the physical thing like what we symptoms we see, it also includes mental and emotional status. As WHO says, we have many more dimensions. Next slide, please. So here also, when I saw the OPD, people used to go to multiple gastroenteritis. They used to visit and they used to get many tablets. And at the end, they say nothing is there. Go to psychiatrist. They get the medicines, come back again. These are the vicious cycle what I observed. Then I felt there is something beyond which we need to address, not just with the rather than a medicine dispenser. We need to address the other dimensions of a person, because the sufferings were there in enormous quantity, and there is a lot of hospital admissions, lot of hospital visit, and the financial losses. There are so many. So keeping that in mind, so I started using what I learned for the last 20 years. I started applying in clinical practice. I started teaching the breathing techniques, yogic breathing techniques, yogic relaxation methods, and some of the people who are very severe. So I even refer to the Unnathi Healing Foundation for the yogic healing. Go to the next slide, please. Next slide.
That's the last.
Next slide.
That's the last.
No.
I think the
It's
previous one of the cases.
Okay.
Previous cases, mark here, table. Yeah, if you look into these tables, I just here the 6 cases have been recorded in this, and I'll go into the second case, which is more important. What I saw in this one is during the COVID era as around 27-year-old male patient who is a working population, who are the most energetic people who required for the society. He was from Canada. He left his software job because of this constipation. He has been visited multiple gastroenteritis. They used to have a constipation, a subcategory diagnosed to have a defecative dyssynergia, and he used to have simultaneously an urinary retention. So where I taught in OPD some of the breathing, yogic breathing techniques, and how the panchakosha, how the sufferings of a person, constipation is not just mere not passing the stools, it is beyond that, how their emotional things have been affected. I explained them how the panchakosha, the multidimensional existence, and I've been referred to the Unnathi for him, and he took almost every alternate day healing along with the other supportive medication. Within 2 weeks, he was able to 60% of the symptoms have been reduced. He is able to pass the stools with very minimal effort, which he was unable to get for over past 2 years with despite of many medications. Then if you look into the percentage of improvement, the constipation almost more than 60% was improved, and urinary retention frequency drastically reduced by 80% by the end of 2 weeks as compared to the 2 years. And at the end of 4 weeks, there are 100% with medicine, he was able to pass the stools. But at the end of 6 weeks, I'm able to taper his medicines, and without any support of medicines, he was able to pass the stools without any urinary retention frequencies, and he was able to handle himself. Later, he learned himself with the yogic healing, and he is able to manage himself for a past more than 6 years. He is on follow-up. Next slide, please. Okay, here also many of the patients they found is they are having in the case number 5, if you look into the patient was diagnosed with dyspepsia and gastroesophageal reflux disease. He was on multiple PPI for a longer, more than 5 years of this one, and these symptom episodes have been increased since last 2 weeks during that COVID era because of the deeper inquiring and counseling. I was able to find out there is a trigger of anxiety, fear. There are some autonomic symptoms were there with suggestive of panic symptoms, and endoscopy was done just before coming to me. Endoscopy was normal, other workup were normal. So we took here the symptoms were very aggressive. Patient is getting severe panic attacks. So I took a help of psychiatrist, and along with the Unnathi healing and other self-healing techniques were taught in the Unnathi. Within 2 to 3 days, almost he was able to show, the patient is able to demonstrate the reflex episodes of came around to 40 to 50%. There is a drastic reduction, and the panic symptoms were able to reduce by 50%. And the complete recovery, it took up to 2 months. And we were able to, after consulting with the psychiatrist, I myself spoke to them. This is a supportive treatment she is receiving. We are able to taper of medicines. So with their help, we almost tapered within a span of 15 days, and all the medicine was stopped by the end of 2 months. And next 6 months, she was in follow-up with me without any symptoms, without any requirement of the gastric medications as well as the psychiatric medications. Similarly, there are many more cases which landed up in emergency ward saying that chest tightness, sweating is there, breathing difficulty, some reflex disease, and epigastric holding. Because majority of the patient, what I observed is epigastric holding sensation, means upper abdominal pain, that holding, they say, because of the gastric I'm having, because that in yogic science we call it as, because whenever there's an intense fear or an anxiety, that chakra concerned with that will get affected. When that get affected, the diaphragm will going to get affected. When the diaphragm get affected, their psychological symptoms worsens, the breathing, shallow breathing starts. So other autonomic symptoms starts. So this is the basic mechanism I used, and many of my patients in my clinic, just a simple yogic breathing technique would have made their symptom free within around, only within 30 to 60 seconds, they will be relaxed, and at least more than 50% of their symptoms were reduced. So lessons what I learned was with this, I cut short at some of the other cases, but it was of similar kind where our yogic breathing techniques, yogic healing was helpful. So just merely saying that WHO has multidimensional health aspects, just to diagnose, evaluate, and say in the words and leave it with the medicines. If a doctor aware about the knowledge of this Panchakosha, the sufferings in 5 different dimensions, how to address these 5 dimensions by a doctor of any kind, whether it's allopathy, homeopathy, or Ayurvedic, or anybody, if they know this and able to give the sufficient, a clear-cut way for their path of health, because unless the health is attained with all other dimensions, it will never be complete. So having this knowledge and applying it in a clinical practice, I felt it is much more useful and beneficial to the patient, and I felt this is a mode what the doctor is supposed to be. Thank you. Sorry, I was little fast because I wanted to finish with.
No, you're fine. We were rushing. Thank you, Dr. Sharad. And I think it's one of the very common scenario where you also have shared that where rest of the medical interventions are not very effective or where it cannot be implemented, yogic healing can have a potential to start. And your data is impressive, even though it's a short number only you could present, but I'm sure in the OPD we can find the greater numbers. Before me getting on too much on the analysis, I would like to hear the research chairs. Dr. Mridu, Dr. Kritika, or Dr. Skantesh, any thoughts?
This is Prabhu. I just wanted to ask a quick question about the yogic breathing. What sort of techniques, and a yogic healing? Briefly, what sort of techniques were used?
Sir, in yogic healing is concerned, we are using a distant healing where we're going to first inform the patient that we are going to be doing the healing and they will be receptive. Later, we'll have a separate techniques to clean their energy body and the chakras, then revitalize those chakras and the part of the aura which is affected with particular colors which are required for that disease. Particularly, suppose if it is an infection, there's a particular color combination which we uses to improve, reduce the infection load as well as to improve the immunity of a person. That's there is particular techniques will be there that we uses to do the healing. Whereas in case of yogic breathing, we do as simple as from the deep abdominal breathing. With that, we in a modern science we call it as diaphragmatic breathing. But this includes particular sequence of inhalation, holding, breath holding, as well as the exhalation, again the holding. There is different yogic sciences speaks in different numbers. Where somebody talks on 6360, somebody talks on 7171, somebody talks on just 5, or somebody equal numbers. There are different things, but each works for different purposes. We use particular sequence for the anxiety and stress is concerned. For other things, if you want to enhance the energy, there are different sequences we use. It's only the modulation of inhalation and exhalation and the holding.
Thank you very much.
And the most important thing, what I observed in this one, everybody in the era of stress and what you call it as, we call just breathers, because everybody, if we look our breathing, we are shallow breathers and the chest breathers. The moment we shift, yogic way says that you need to breathe through stomach. So the moment you shift from the chest to the stomach, the whole hemodynamic, the pressure changes in the abdomen and in the chest will change. That itself will give the miraculous results.
Thank you.
I think the concept of yoga is the same, which is again used by all the yoga therapists and teachers. Is that I'm understanding right? But the yogic healing, where it is involving an energy healing distant therapy based on the Panchakosha and cleaning of Panchakosha or intervention of Panchakosha, where the healer is doing it, I think that component is different. So, but the rest, asana to yoga postures and breathing, I think they all are just the yoga practices which we all are aware as yoga. If I may request, of course, we have heard the Unnathi work and the evidences and everything, but I would really like all of us to meet. I was honored and blessed to already meet, but I would like to have a quick invite to Dr. Saraswati Aigre, who is the founder member and also who has developed this yogic healing, and her own initiative, her sole initiative actually raised the whole campaign, and it turned into be evidence-based last year with all the wonderful work they have brought together. So Dr. Saraswati, if you're here, please, if you can conclude the session with your recommendation, suggestion, and guidance for the future. Thank you.
Thank you. Namaste, everyone. It's a wonderful session to be with all the medical doctors. Even though I'm not a medical doctor, it's a wonderful session. It's an eye opener for all of us by Dr. Neha's idea of bringing practitioners to share their experience. It is very, very important method. I really congratulate and appreciate your entire team. It should continue and become widely accepted. Secondly, maybe one or the other day we have to wish or visualize or pray to make yogic healing or biofield therapy to become part of the regular protocol in any kind of treatment. It should be patient oriented. It should become part of the protocol. Especially we have seen all these cases. Also, we have done a lot of work with the surgeries pre, during, post. A lot of complications can be reduced. Every aspect of the treatment. So it's a very, very wonderful. Finally, my experience is whoever has learned healing, one healer at a family makes a lot of difference. It's important, whatever the protocol, whatever the treatment you take, other Ayurveda, homeopathy, allopathy, whatever it is, don't take a chance of somebody's life. Take a support of yogic healing, irrespective of whatever the part of the globe you may be staying. It is simply easily available, remotely can be implemented. So thank you for this wonderful time. I won't take much time because already have exceeded the time. Let us continue to work together, reach out more people, make life better on this earth. Let us spread and share the love and happiness with everyone. So, namaste. Congratulations to all the researchers. Namaste.
Thank you. Thank you, Dr. Saraswati. It's a pleasure to have you and hear what took you on. And I think two messages in terms of practice and research, what I have found working with all the practitioners of yogic healing. One, we call it supported self-care. So they are helping everybody to look after their own self-health, their own well-being. And through that, with that support of healers, of course, we are encouraging supported self-care. But at the same time is also the self-healing, because in most of the parenting work, and as Dr. Saraswati just mentioned, teaching the people to take care of their own health through the yogic healing. So many parents who learned the yogic healing so that they could provide better support for children. I think that also a wonderful model where you are making them self-sufficient. So the self-care is better promoted, and the burden of the care on the practitioners get reduced. So it could be a long-term impact, which is yet to be found out from the practice, but I think it's worth looking at that how much it reduced the burden on other practice or healthcare system. So I would suggest Dr. Sharad, Dr. Bharti, also not to undermine the impact in terms of how much you have reduced the pressures on the healthcare system, where when you taught these parents or people the self-healing, we would like to see how much now they are less booking appointment and rushing to the hospital, but rather they take care of themselves first. So I think that important aspect we didn't think about, but I would like to see in the prospective papers and suggestions. But anything else, if we have missed, if we have like to work ahead more, Dr. Skantesh, Dr. Mridu, Kritika, or anybody from the group would like to make any suggestion, recommendation, please feel free. We are hoping to compile this as a roundtable discussion. So yes, it will be nice to hear the comments from the experts. Thank you.
Yes. Really nice session, Dr. Neha, and thank you for bringing everyone at this for all together. And as Dr. Saraswati mentioned that it can be done remotely. So I think I might be suggesting it to my patients also so that they can heal better.
I think that would be a wonderful idea. A very important part, especially for the patients who we have limitation to reach first with any conditions, like for instance, and everybody knows because Yogic Healers were on Aarogyam platform with the chronic pain patients, and one of them, especially child who had a limitation, was a very high sensitive boy who could not take any medication, and when I referred to Unnathi, and even the paracetamol or ibuprofen or simple antipyretics, which could not be given to him, and there was no help which could actually do. He won't open his mouth because he was highly sensitive for taste and smell or the texture. So yogic healing actually came as a bridge to even provide the very first support where and it's a young child, so the drip to injection was denied. There was no hospitalization required, but for preventing the major disasters or any further complication, yogic healing was introduced in the very first stage. And we saw that the one who was not taking anything else or who could not take anything else for any limitations, yogic healing did help, and it did bring down significant changes where he was eating, drinking, and slowly we did introduce the medicine in terms of recovery. But he didn't require that anymore because he recovered very quickly within 2 days. So I think keeping in mind that it could be the first call, at least where every other measure is having a limitation to start with. And also it could be a measure where the major limitations of continuing long-term treatment, and we don't have long-term treatments available. It's a supported self is required. I think this is where yogic healing could be self-sufficient. And as simple as Dr. Saraswati and everybody explained, you can learn for yourself, which means I could be my healer and I can look after all these changes on my own. So there are cases we have seen in Aarogyam, and on the camera during the group sessions, we have seen an acute pain situation where the patient was failed of all measures, and she was actually just in 15 minutes of yogic healing in the group session, she walked up and down on the stairs in front of all of us. So again, I won't deny the fact that as a medical professional, this is hard to believe, and we would take placebo effect to pseudoscience, whatever we say, but I think it's beyond that because even if it's a placebo effect, nobody else could make this difference. So how the yogic healing could do is worth notifying. We know the significant challenges, but we know the opportunities here which yogic healing is presenting. So I would like to see, challenges are always outstanding, but I would like to see the greater opportunity for greater patient care and collaborative work, which healers, researchers, and the public, which is patient themselves, could make a better outcome measure system, and we can document better scientific work. So without taking, I know we have taken, but thank you very much for joining, and thank you very much, Unnathi Healing Foundation, all the team, and Dr. Saraswati specifically, for bringing this wonderful work to the world, and hopefully we will be able to share widely and continue working with you on this regard. Thank you, everyone who patiently stayed with us, and I look to hear more on the IAN and our practitioner research platform. We will be holding these meetings every last Sunday of every month. So next meeting will be on 26th of February. Would like to hear more from the Ayurveda psychotherapeutics part. So I'll hope to see you again next month on the same time, same link, on the SIG platform. Once again, thank you everyone for joining, and thank you, Unnathi team, for bringing this to us.
Special thanks to you yourself, because you are the mind behind all these things. And also I mentioned thank you Mrudu ma'am, and also Kritika and Dr. Skantesh. Thank you very much.
Thank you. See you soon very much.
Thank you.
Thank you.